How are sickle cell leg ulcers treated? When it comes to treating sickle cell leg ulcers, a combination of strategies is essential for effective healing. These ulcers can be quite challenging due to the underlying sickle cell disease, which affects blood flow and oxygen delivery to tissues. So, how do we tackle this issue? First, local wound care is crucial. This involves cleaning the ulcer and changing dressings regularly to keep the wound moist and prevent infection. Sometimes, dead tissue needs to be removed, a process known as debridement, to promote healing. Compression bandaging can also be beneficial. It helps reduce swelling and improves blood flow in the legs, much like treatments for venous leg ulcers. Pain management is another key component. Ulcers can be very painful, so controlling that pain is important for comfort and recovery. Infection control is vital as well. If there is a risk of infection, antibiotics may be necessary to treat or prevent it. Now, let's talk about managing sickle cell disease itself. Hydroxyurea is the only medication approved by the Food and Drug Administration for sickle cell disease. It works by increasing fetal hemoglobin, which can help reduce the sickling of red blood cells. However, its effects on leg ulcers can vary. Some patients report that their ulcers worsen while on hydroxyurea, but they improve after stopping it. Chronic blood transfusions may also be an option. By increasing hemoglobin levels, they can improve oxygen delivery to the tissues, which might help with ulcer healing. There are newer drugs like voxelotor that are being studied, but their role in treating leg ulcers is still unclear. For some patients, adjunctive treatments like hyperbaric oxygen therapy have shown promise. This therapy enhances oxygen supply to tissues, which can promote healing. Other experimental treatments include topical timolol and collagen matrices, and in some cases, surgical options like skin grafts may be considered for chronic ulcers. Prevention is just as important as treatment. Patients should avoid trauma to the legs, wear properly fitting shoes, and protect their skin from insect bites. Early treatment of minor injuries can also help prevent ulcers from developing. Nutritional support, particularly zinc supplementation, may aid in wound healing as well. Managing sickle cell leg ulcers often requires a team approach. This means coordinating care among hematologists, wound care specialists, pain management teams, and sometimes surgeons. Due to the nature of sickle cell disease, healing rates for these ulcers tend to be slower than for other types. Recurrence is common, which highlights the importance of both active treatment and preventive measures. If you or someone you know is dealing with sickle cell leg ulcers, it's crucial to seek personalized medical care from professionals who understand both sickle cell disease and chronic wound management. This ensures that the treatment plan is tailored to individual needs for the best possible outcomes.